Henry is just a ball of energy. He's the sweetest kid you'll ever meet. He's just always on the go, always running around, always inquisitive about everything he comes across.
Henry is adorable. That's one of the first things I remember about meeting him. He first came into my clinic when he was 4 because he was already followed by the Neurofibromatosis Center because he has a family history of NF1. Neurofibromatosis type 1 is a pediatric brain tumor predisposition syndrome. Kids with NF1 have about a 15 to 20% chance of developing an optic pathway glioma. And although these tumors are low grade, they can result in significant neurologic problems, including blindness. It has effects on metabolism. It has effects on cognition and learning. They have risk of developing benign tumors of their peripheral nerve that, despite their benign nature, can cause a lot of pain and other related symptoms. He was referred to my clinic because we were concerned that he was losing vision. And they found out he had an optic pathway glioma. By the time it came to me, it was deteriorating in both eyes. It's not operable. Optic pathway gliomas in patients with NF1 are almost always infiltrative through the optic nerves and into the deeper regions of the brain. And so if you were to try to remove it completely, you would at the very minimum cause blindness. We talked to family about different treatment options and ultimately decided to start a biologically targeted agent that's targeted towards some of the pathways that are abnormal, and that drug is a MEK inhibitor.
She was just so kind and caring. She made us feel really comfortable with putting our 4-year-old child on a chemotherapy drug.
That has actually been quite successful for him. He hasn't had a lot of toxicity, and his vision improved on the course of treatment with this drug. And we ultimately got to the point where it was successful enough that we wanted to see if we could wean him totally off the drug, which is kind of where we are now.
I can't imagine what we would do without doctors being able to really research and develop these drugs. The information they've gleaned about neurofibromatosis has changed immensely since even we were diagnosed. It's so vital for hospitals and doctors to have access to grants and donations to be able to fund research and to continually innovate.
WashU and St. Louis Children's are a great environment to be in for pediatric research. When we're looking at these early life exposures and risk of brain tumor formation, it's going to have to involve other specialties, so things like obstetricians and neurologists. So a lot of that is just enriched by the atmosphere we have here. The other thing WashU has is a really tremendous research infrastructure. Pedal the Cause will take projects that are kind of in the very early stages of development. We don't have enough pieces of the puzzle to really qualify for the big NIH grants that will help fund an entire lab. And so Pedal the Cause is actually helping us get those pieces of the puzzle, to get those larger grants, to ultimately be able to translate our findings into improving kids' health.
To all the Pedal of the Cause donors, it's incredibly impactful, everything you do for children at Children's Hospital. If one access point was missed or one diagnosis was missed, we could have had, vision loss.
Pedal the Cause funding has funded so much pediatric cancer research here at Washington University and St. Louis Children's Hospital over the last decade. We're all very grateful for the people that are willing to open their hearts and open their wallets and really recognize how important it is to fund research into pediatric cancer so that ultimately we're able to design better therapies for kids that come in with tumors.
My main wish for Henry is to just grow up without a care in the world with respect to his medical condition, to just know that he is just like everybody else. And just because he has a few minor medical setbacks doesn't mean he can't achieve everything he wants to achieve.